Thank you all for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Friday, September 17th. As we've said many times in the past, we will always be dynamic and flexible when it comes to measures and approaches with respect to COVID-19. And as the epidemiology changes, as the evidence changes, we will change with it. Because if we've learned nothing, that is the right thing to do when it comes to this pandemic. And that's what we're doing today with respect to masks. So with that, I'll turn it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory 2 days ago, I guess, we have 4 new confirmed cases of COVID-19 in our province. 2 are in Labrador Grenfell Health. Both are contacts of a case and previous presumptive positives, and 2 are in Eastern Health. One is travel-related, and the second is still under investigation. There are no new presumptive cases, and the total number of cases in our province is now 1,555. There have been 15 new recoveries, 7 in Eastern Health, 2 in Western Health, 6 in Labrador Grenfell Health, leaving 38 active cases in the province. No one is hospitalized as a result of COVID-19, and a total of 286,325 tests have been completed to date. We have been closely monitoring the epidemiology outside our province, and we are seeing a substantial rise in COVID-19 cases across Canada. The Delta variant is now the dominant strain circulating in Canada and among our provincial cases. This variant is more easily transmitted and causes more severe disease than the original COVID strain. So in response, most jurisdictions are escalating their public health measures at this time to curb the spread of the virus. We, as the Premier has said, have committed to adapt our own public health measures when the evidence shows a change is warranted. Therefore, effective midnight tonight, the special measures orders requiring masks in indoor public spaces will be in effect. Masks will be required in the following settings: public transit, including buses, taxis, car services, and public areas of ferries, retail businesses, shopping malls, community markets, and service companies, common areas of an office building that is accessible to the public, common areas of a tourist accommodations, places where municipal or government services are offered to the public, places of worship and funeral homes, cinemas, theatre and performing arts venues, indoor entertainment venues, any rental room, community centre or other venue used to host gatherings, sports-related clubhouse, community museums, historic sites, bingo halls, fitness centres, dance and yoga studios, arenas and other places where sports or recreational activities are practiced, restaurants and lounges, and post-secondary educational institutions, including colleges, universities, and trade schools. For K-12 schools, masks are required on school buses, as well as in common areas of the school. Students in grades 4 to 12 are required to wear masks at all times while in school. Staff are also required to wear masks at all times while in school. This is the same as was previously, as with our previous mask order. There are some exceptions to the special measures orders. Private offices and workplaces that are not open to the public are excluded from the requirement. However, they may implement their own masking policies. Masks are not required for children under the age of 5 and people with physical or mental health conditions that prevent them from wearing a mask. Masks will not be required while individuals are engaged in moderate physical activity, and in these cases, the mask can be removed for the duration of the activity only. Masks are not required while eating or drinking, but must be worn when moving around an indoor setting when not actively eating or drinking. Masks may also be removed for validating identification. Masks, coupled with vaccination, are a way that we can reduce our risk of COVID-19 transmission, and in light of this highly transmissible variant. There are several reasons why we made this decision right now. First, we want to ensure that children can stay in school for their physical, emotional, and developmental health. There is no vaccine approved for children under the age of 12, so it's up to all of us to keep their risk low. And masking is a small change we can all make that will have a big impact for children in schools. Second, we need to ease the pressure on public health resources. Right now, public health capacity in the regional health authorities is strained, and cases have been increasing over the past number of weeks. And on average, each case has a much higher number of contacts than they did some months ago, and more contacts are deemed to be high risk. Since August 27th, there have been about 60 potential COVID-19 exposure advisories issued, and we have seen greater wait times for testing because of this. Mandatory masking would significantly decrease the number of public advisories required, as many of these settings would be deemed low risk in the context of masking, coupled with high vaccination rates. The increased transmissibility of the Delta variant will require more of us to be fully vaccinated to provide community protection. I urge any of you out there who are not fully vaccinated to get vaccinated. As always, we will continue to watch the epidemiology, and when we are back in a place where we feel it's safe to remove the mandate, we will do so. Masking will not be forever. When we remove the mask mandate, we continue to strongly recommend it, and I know that most people follow that recommendation and continue to wear a mask. We have reached a point where we need to step up our requirements as a proactive measure. This is a small action that we can all take to give us that extra layer of protection to help keep our schools, communities, and province safer and open until we can get our vaccination rates higher. I know this is not where any of us wanted to be today, but as we have proven many times before, we can face any challenge if we do it together. So thank you for joining us today, and I hope you have a safe and enjoyable weekend, and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Just pick up a comment on a comment you made about vaccines. As we've said many times, vaccines are the number one thing that we can all do to help protect each other and ourselves, and help get rid of masks and go back to a more normal lifestyle. So please, anyone out there who hasn't been vaccinated, please, please get the vaccine. It won't only help you, it'll help your neighbors, it'll help your community school, it will indeed help the entire province. Together we can get through this, but we need everyone doing their part. And I know there's still some anxieties about vaccines, but I encourage everybody to please don't just trust Google. Google's not a doctor. It can provide some evidence if you know what you're looking for, but please trust the experts when seeking advice when it comes to vaccines. They're safe. You heard me say many times, vaccines in general have been one of humankind's best inventions. So please trust the experts, get vaccinated. I've also received some recent commentary with respect to the vaccine passports, and that it will be divisive amongst Newfoundlanders and Labradorians. I don't subscribe to that. What I do think it will do is allow us to bring us all together, to protect ourselves, to ensure that those around us are protecting us as well. So please do your part. Get vaccinated, and together as a society, a community, and as a province, we will get through this. I'll now turn things over to Dr. Haggie, Minister Haggie, for a brief update.
Thank you very much, Premier. We've said all along that COVID was a changing environment, and this is just another change, unfortunately, in the road. I think the comments made by Dr. Fitzgerald around health system capacity are one of my main concerns, given the high number of contacts that a mask-free environment has generated of late. It takes a toll on contact tracers, and we have had to recruit our second and third line tracers to help out our public health staff. I would like to take this opportunity once again to thank our public health staff for all the sterling work they've been doing and continue to do. We have seen a five-fold increase in the daily number of tests generated as a result of these location-based advisories. We will be able to reduce that with the measures that Dr. Fitzgerald has announced today. And I would close by echoing what she and the Premier have said. If you haven't had a vaccine, get the shot. Thank you very much, Premier.
Thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 2 media in person and 2 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Dr. Fitzgerald, I want to ask about masking. You've said that even without masking being mandatory, most people are still wearing them. Anecdotally, in grocery stores, that still seems to be a case. So since mask utilization is already quite high, why does it need to be made mandatory at this point?
So, I mean, I think we see that mask utilization is quite good in some areas. I don't think it's good in all areas. I think we've had an outbreak that has, that has proven that. So we, and we know that, it's not being used in schools at this point. So I think we just need to make sure that we're adding that extra protection. And we know there has been some research that's been done to show that adherence does increase when we have a mandate in place. And so I think that's where we, that sort of helped to inform our decision. And seeing what's happening elsewhere, I think it's prudent to do so.
And I want to ask about vaccine passports because the position seems to keep changing. Earlier this week, it was going to be optional for businesses if they wanted to use it. Premier, you had a tweet out that now says it's going to be mandatory for some non-essential activities. A lot of people, including businesses, are quite confused about this sort of back and forth.
I'm happy to clarify any confusion. I think what it was based on was it was a tool in the toolbox comment, given the level of epidemiology and that we're seeing. But currently, we are seeing a concerning level of epidemiology, so it would be mandatory for non-essential services, period.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Thank you. Dr. Fitzgerald, also on the mask mandate, why as of midnight tonight, or why make this announcement, I guess, today on Friday?
I think when we feel we need to make a decision, we need to make a decision. So, we're here. We feel this is what we need to do. Why wait? So that's why we brought it in today.
And Premier, Alberta has noted that they're looking for provinces' help in terms of whether they can take COVID-19 patients, help and provide supports other ways. We did this for Ontario earlier. Is this something the province is looking to help in terms of aid for Alberta?
Yeah, absolutely. I spoke with Premier Kenney last night. He reached out, and their system is quite strapped, of course, as we've seen. And he was looking for any help we could provide. So we are currently doing an inventory of what we're able to provide in terms of human resource capabilities. And we're certainly working towards a model that would be akin to what we did for Toronto. This is, again, as this is a virus that impacts all of us as Canadians. And if we can play a small part in helping the healthcare system in Alberta, then we'll all benefit from that. And it's something that I think we should do if we're able to do, and we're assessing that ability right now.
We will now go to the phones. Our next questions are from Noah Shepherd with VOCM. Please go ahead.
Hi, this question is for Dr. Fitzgerald. About the size of public gatherings, is that changing in any way to protect against the Delta variant?
No, not at this time. We will be requiring masking in any public gatherings, but that are indoors. But the size is not changing at this time.
So for weddings and funerals, will masking still be required for there?
Yes.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. I'm wondering about children in grades less than grade 4. I'm sure a lot of parents are wondering why their children shouldn't wear masks. Is there a reason for that?
So I think their children should wear masks if they're able to do it. The issue is that, we know there's children in the younger grades may have some difficulty with that, and putting in the force of an order, we don't want them to be not in compliance with the order because of issues that may be beyond their control or understanding. So we are, we certainly encourage parents to have their children wear masks. We encourage mask wearing in the school as much as possible, just as we did before. But this is the same as what we had in place previously.
Okay, thank you. And I'm wondering the mRNA vaccine manufacturers are now suggesting booster shots should be given within 6 months of for anyone who received their vaccines. Is this something the province is considering? Have you been following the NACI guidelines or discussion about this?
So we take our advice from the National Advisory Committee on Immunization, and I know that these are all questions that they're actively investigating at this time. And when they make their recommendations, I'm sure, we will certainly be taking that into consideration and looking at how we can incorporate those guidelines into our practice here. But we'll be waiting for their advice on that.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do. For Dr. Fitzgerald about vaccine passports. Back in July, you said, we're not going to require anyone to release personal health information, which a vaccine status would be to anyone. That's a person's right to decide if they want to do so. To require it would be infringing on their privacy. So has your position changed on this and vaccine passports, and if so, why?
So I think we, we're in a different place than we were right then, and we had, and I'm not sure the context of what that question was asked. It's a long time ago now, but certainly we know that all steps are being taken to protect people's privacy, and that we're not actually, releasing the actual information of their vaccine, what vaccines they've had or anything like that. So this question, of course, has been dealt with by people outside of me, and I'm sure that everything has been done to protect people's privacy to the greatest extent possible.
Kellyanne Roberts with NTV, do you have a final question?
Yes, thank you, Leslie. Premier, we've heard from nurses on the front lines, and I'm sure you have every day as well. They say that our healthcare system here is pretty well at capacity. What are we doing to help alleviate them with the idea that a fourth wave could be coming to the province?
Sure, we're closely following the situation. I spoke to Ms. Coffey today, and we have a great working relationship. We recognize that this time has been incredibly stressful for nurses and indeed all healthcare providers. And we're looking at creative solutions for the future with respect to our own province. But as you've seen, this is not a problem that's unique to Newfoundland and Labrador. It's across the country. This time of stress, this time of need has exposed some cracks that are probably a little bit more than cracks than we would have liked to admit, and are actually some crevices, and we need to make sure that we're working together to fill those. That will take, short, medium, and long-term strategies. There's no easy fix. Money's not always the answer. If it was, some of the more wealthy jurisdictions would have this fixed already. This is a series of forces at play on the healthcare system, unfortunately culminating in a time of a pandemic, but there's changing workforce, there's changing demands from members and employees, and it's all unfortunately hitting at the same time. But we've been committed, and I think Ms. Coffey would echo this as well, to working with her and her members, appreciating what an incredibly valuable service nurses provide to the province, and especially during this time of stress.
Noah Shepherd with BOCM, do you have a final question?
I do. This relates to the situation in Eastern Health. There were a couple gatherings which were highlighted in the releases about the COVID updates. I was wondering if there's been any recent developments in that situation, and if you could give us a little more detail about these gatherings.
So Public Health has done their investigations, and I'm not involved in the day-to-day investigations that happen in those, so I can't really give you any major details with regard to that. But there were a couple of larger gatherings that had happened, and we had exposures at those gatherings. We've had, I think, 10 cases now that has been related to one of those gatherings, and as far as I know, none in the others. But we're still following it through. We're still within that 2-week window of the incubation period. So, and we do test people towards the end of that period. So, we'll see what the next few days bring, I guess, with that.
Thank you.
Peter Jackson with the Telegram, do you have a final question?
Yes, this is sort of a follow to Noah's question. You talk about the epidemiology across the country, but I'm wondering, were there any indications here? What sorts of things about our own epidemiology led you to make this decision?
So I think we have to consider two things when we're talking about epidemiology. So our epi may be good, but, you know, our risk for importation may still be high. And we see that with travel, and we've certainly seen that we've had travel introductions into our province. Some of the things that were concerning to us, number one was the fact that we've had several cases where we've not been able to find a source, so we've not been able to link it back to travel or to a contact. And those cases had started, outbreaks, but had sort of started the investigation and led us to discover outbreaks in certain areas of the province. So that's another concern that we're seeing. And just seeing what's happening so close to home in the other Atlantic provinces right now certainly made us concerned that this may happen. So we're looking at not just our own epi, but epi everywhere else, and it's really difficult to consider one without the other. But those non-epi link cases certainly is a concern, and then the number of contacts that we've had in these cases, and then what we've seen in unvaccinated pockets throughout our province. And certainly now we're looking very closely at those unvaccinated pockets so that we can improve vaccination rates across the province.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Yes, thank you all for joining us today. I would like to highlight, I just was on our weekly Indigenous leaders call, and there was some concern that there has been some reports of their numbers not being as high as they actually are. So I did speak with President Lamp and told him I would use this forum to clarify that they actually are doing incredibly well, as are most of our Indigenous communities. The NG in particular has upwards of 90% with one dose and over 83%, I believe. If I'm off, it's only by a variance of 0.5 or something. With 2 doses. So I think, given this forum, it's appropriate to correct some misinformation that may be out there. I want to reiterate the importance of ensuring that people get vaccinated. If you want the masks off, you have to get the shot in. And that's the best way to return to life as normal. And so please do your part to protect Newfoundland and Labrador. Thank you very much for joining.